When a person has diabetes, they may be at risk of developing a foot ulcer and potentially suffering an amputation. It's a very common complication and a particularly serious one. Medically, it's known as peripheral neuropathy. Now, even though doctors recommend everyone with diabetes has a foot examination every year to look for early signs of peripheral neuropathy, over 500,000 people never have an annual foot examination. In fact, about a third of people with diabetes aren't even aware of the test. The cause of neuropathy is damage to important nerve fibres in the feet, and it's often picked up quite late. Some of these nerve fibres provide vital protective sensation. And when that protective sensation is lost, unfortunately, it's gone for good. And that increases your risk of developing a foot ulcer or tripping and falling and injuring yourself, particularly if you're frail. Of course, prevention is always better than cure, and diabetes-related foot problems are no exception. But if problems do occur, it's important to pick them up early when treatment can stop them getting worse. Neuropad is a simple, painless, 10-minute screening test for early signs of neuropathy that can be used alongside so-called sensory tests. Neuropad's recommended for use by care home staff and the relatives of people living in care homes or people receiving care at home, so-called domiciliary care, because they can be more vulnerable to foot complications if they can't respond to standard care tests. This could be because of mental and physical frailty or because of problems with communicating or understanding. For instance, the monofilament examination needs you not only to recognise the sensation of your foot being touched with a tiny tool, but to be able to tell your healthcare professional reliably when you're feeling it. Unlike subjective tests, such as that 10-gram monofilament, Neuropad is an objective test. It resembles a sticking plaster, but it's got a blue pad in the centre. You stick one on the sole of each foot and 10 minutes later you look for a colour change. That means if you're looking after someone who can't use the test for themselves, you can do it for them without any risk of the test being less accurate. The National Advisory Panel of Care Home Diabetes recommends Neuropad as an add-on test to sensory testing for that reason. Now, there are also lots of people with diabetes who don't routinely attend their clinics to have their annual foot assessment. Neuropad isn't a replacement for regular foot checks, but for people who've missed a foot check, using Neuropad at home can give an indication of whether they're at higher risk of foot problems, meaning it's even more important for them to see a healthcare professional. Now, Neuropad is not yet a standard of care test, and it's not intended to be a replacement for monofilament testing, but it does provide an opportunity to identify earlier signs of neuropathy, which might then need investigation. So you can think of Neuropad as an early warning system for feet at risk, and the earlier you know that there's a problem, the better your chance of avoiding more serious problems later on. For more information about Neuropad and the published clinical evidence supporting it, please visit neuropad.co.uk.